Thank you for having me. I am the owner of V.I.C. Pet Care. We started our business back in 2010, focusing on like pet sitting, dog walking. But about 6 years ago, we started to get into the non-anesthesia dental cleanings, and it's become very popular.
How did you get into that?
So I was a vet tech for about 20 plus years. Dentistry was always kind of my passion. I kind of always did cleanings on my pets, and then I just kind of started offering it to my clients, and it just kind of word of mouth, and it's kind of grown and become very popular.
Nice.
So, yeah.
So Vic is going to be here this Friday, August 30, doing her anesthesia free dental cleaning at Lucky Pet. And of course, people have so many questions regarding anesthesia free dental cleaning. The first one that pops into my head is my dog a candidate?
Okay, perfect question. Good question. So initially, we always do a dental consult. So I look at their mouth, I look to see if I see any broken teeth, any infection present, gum recession, root exposure, anything that brings up concern. Then I would definitely recommend them going to their vet to go under anesthesia for x-rays, medications, extractions. Okay. If it's mild to moderate tartar and they're younger and they have either they've had a dental under anesthesia recently. This is more of an alternative and preventative to keep them from going under, more often. Then they would be definitely a candidate.
Nice.
And if they only have kind of mild to moderate tartar, it usually takes about 30 to 45 minutes per dental.
Okay.
Obviously, if they're holding still for me.
Yeah. And I think you mentioned before we started the video that pet parents can be here. During the procedure.
Yeah. So and that's one thing is that the moms and dads always say, I think he or she will be better with me or without. They usually know how their pets are.
Okay.
So
and the other question, hyper puppies, anxious dogs, how are they candidates? How do you get them to calm down during the procedure?
Yes. So I always recommend if your pet has a lot of energy prior to maybe taking them for a run or walk or go to the park, get some of that extra energy out.
Okay.
Once they get here, obviously they're not going to be, as calm as I want them to be. So it's good. It takes a little time and trust.
Okay.
So I would say within 10 minutes with the high energy dogs, I tend to finally get them to calm down. With the little ones, I usually wrap them in a puppy burrito in a towel.
Aw, that's cute.
Put them in my lap, and they just calm down with that. With the bigger dogs, sometimes they'll sit down for the procedure. But once they start trusting and they realize everything's going to be okay and I'm rewarding them throughout, the big guys usually end up laying down and putting their head in my lap. Actually,
nice.
People are pretty surprised that I can get them to calm.
So Vic doesn't drug any dog or she doesn't do any anesthesia, but if the owner wants to give them some calming pills or CBD, could they do that?
Yeah, I mean, especially if they've done that prior. I always say I don't recommend trying something new prior to coming to see me.
Okay.
You always do kind of a trial run at home. But yeah, if there's anything you've tried at home, for storm phobias or traveling, and it's kind of worked, definitely give it maybe an hour or so prior for the dental